Guys, please, guys, if you see me live on Facebook, please, guys, let me know. That's, guys, a file. We made it for part 2, champions, because I know it's a little bit hectic to you guys to understand about part 2, which is normal at this stage, because it's a new journey, it's a new way, new road. You're going to go through it. So it's very normal. So, guys, don't be stressed. But me and Dr. Alethia, we made this file together. And then, just to make it easy to you, please, Dr. Lama and Dr. Leia, if you can reshare the link that you can give the candidates so they can text you, and then please give them this file so they can read it when they have time. But anyway, we're going to go through it. But I think it's going to be good if you guys want to read it. Let me check if anyone wants it. Guys, you have two options right now. You can comment on Zoom or you can comment on Facebook. Please, guys, if I'm Facebook Live, please let me know. Okay, guys, Dr. Lama has actually sent you the link. Please, guys, just click on this link. And please on Facebook, please, guys, if possible, please, Dr. Leia, Dr. Lama on the Facebook, because I believe I'm now on the Facebook as well. So if you can comment there on the Facebook and send them the link, share the link there, that will be even very helpful to all champions. Okay, guys, a brief about today. Today we consider it as one of the most important class, either for part 1 and part 2. For part 1, because I see most of you guys starting your journey for part 1 and you got the result. And some of you got the result and they actually had to do the exam again. We got lots of messages from the candidates, lots. I don't know why this time, there are lots of messages that the candidate have done courses, I mean like without even courses, whatever, but they up to give up. And then I'm telling everyone here, if you have done the exam and then you're very close to give up, don't give up. We're helping you. Just text us, talk to me directly, personally. I will be very happy helping you. And Dr. Franzi will be here to give you her own experience about part 1. Now, the second part, or actually still the same, which is what we're doing right now, but this is going to be mainly for part 2. For part 2, Dr. Franzi is going to go through her experience about part 2. How did she pass part 2? And I need every one of you guys, please, before we start this, I need everyone to congratulate her first in the first instance. And also, personally, I really very thankful and grateful to Dr. Franzi. She's coming today, because she's coming today. And then she's helping every one of you guys to give her own experience. She's overseas right now with time difference and is supposed to be in her holiday. However, she's very happy to come today and help every one of you. So please, guys, congratulate her. And personally, definitely, I appreciate her very much. Now,
thank you, Dr.
We have, yes, Dr. Franzi?
Thank you. That's very nice of you. Thank you.
Thank you, Dr. Franzi. You really deserve it. You're a very nice person. You are a beautiful person inside, outside. You have a big heart. I met you personally multiple times. You've been always in the sessions. I know you very well. And I'm very proud. I'm very proud. I'm very happy for you, Dr. Franzi.
I'm blushing, Dr. Beto.
Thank you very much, friends. I think you're very famous, by the way. I believe most of the candidates, they know you because you used to do role plays, either private classes or our Tuesday sessions for everyone. And we have Dr. Alefia. She's here today and she's going, guys, to give us the roadmap with me. Me and Dr. Alefia, we're going to give the roadmap and to go through what exactly we need to do to start part 2 as well. and Dr. Leia and Dr. Lama, they are here, and Dr. Anne as well. Me and Dr. Alifia and Dr. Anne, because I have seen Dr. Anne as well. We'll be here, guys, guiding you through part 2 map. And we can explain things to you. I don't mind how long we're gonna stay. We can stay 1 hour, 2 hours, 3 hours. Depends on you. If you are a candidate really wanna pass the exam and you wanna be successful in this journey, you must put effort. You shouldn't feel bored. You should be staying for 1 hour, 2 hours, 3 hours. Never. You shouldn't never feel bored. So me and Dr. Alifia and Dr. N, we're gonna go through, guys, the roadmap together. We're gonna simplify the things. We're going to simplify the things to you for how to start part 2. We're gonna get all your questions once we already, guys, made this file very easy for you anyway. Okay, so we're gonna go through it together. We're gonna explain to you in details, and at the end, after we finish this file, if you have any questions, you can ask us. By the way, guys, as you see right now, this file, right, it's very easy and very straightforward, because actually we don't want to introduce ourselves. We will not go into introduce ourselves. If you don't know who we are, that says bonus. Thank you very much. If you don't know who we are, now it's very easy just to go on Facebook page and write down, or maybe on ChatGPT, whatever, just write down Dr. Alifia or Dr. Adam. You will find everything about us. So we don't advertise for ourselves here now. We don't do any marketing. We're not going to show any photos. We have lots of photos everywhere since 2011. So we don't have time to do this right now. Our focus, our concentration is to help our champions, our candidates. Okay, now, I believe, let me check, because some candidates, they know the session is 8 o'clock. I don't want to really them to start late. By the way, guys, let me announce this as well for part 1 champions. Do you know, guys, when they're going to be the mock exam discussion? For our part 1 champions, guys, do you know when going to be our mock discussion, guys? Seems like no one knows. Our 1, 2, 3 batch, I have a big hope on you. I'm telling Dr. N and everyone in the academy, you guys will be fantastic. Please, guys. I'm telling them that's batch 1, 2, 3. Because, guys, I tell you something. From our opinion, the best 2 patches so far, we love all of you. We love all our patches. But as a result-wise, the best 2 patches has happened to us so far. 111 and 121. 111 patch and 121. Almost everyone has passed these 2 batches. And we're saying batch 1, 2, 3 starting very good. Like very good. Dr. Anne, are you there? Yeah, Dr. Anne, even she said it. Look at this. Dr. Anne, are you there?
Hi, Doctor.
Dr. Anne,
Yes,
guy is sick, right? Hi, Dr. Anne, how are you going?
I'm good. How about you?
Sorry, Dr. Anne, how you feel right now?
Just my throat is not getting better anytime soon.
Guys, batch 121 made Dr. Anne sick and tired because since the result time, she's sick. I hope she's getting better then.
Absolutely. I hope the same, Doctor.
Okay, guys. So now we have a big hope on batch 1, 2, 3. 1, 2, 3, right? Yes. Even the number is good number. 111 is good number. 121 is good number. 123 is good number. Okay, guys. Dr. Bidu, 1 is the lucky number. Change your group name to 131. We're waiting for 131, by the way. We're waiting for this batch. But I believe 1, 2, 3 is it will be perfect batch because I see you guys, you're really doing great. You're really doing great. Okay. Back again. Let me just, maybe you guys you can hear echo now. Give me a second. Please, guys, if you hear echo, please let me know. And no echo now? And also no echo now? That would be great if there is no echo. I think the echo will start. That's okay, Dr. Zoa. You're not very late. That's okay, Dr. Zoa and everyone. Okay, guys. So, guys, yeah, Dr. Wayne said tomorrow. Tomorrow, guys, will be the mock discussion. And on Monday, we'll have I see this based on your votings. So, guys, you vote for it. And based on votings, we actually going to have I see this. Okay, guys, just to conclude this quickly before we start. Guys, everyone here, today, it's a big session for Part 1 champions. It's just to start the journey. And by the way, I shouldn't forget to congratulate our batch 1-1 champions. I really feel happy every time I remember about them. So congratulations to you guys. You made me very proud and made everyone in the academy, including Dr. Ann, Dr. Ken, Dr. Lay, and everyone. And Dr. Sam and everyone, guys, being very proud of you. Having this high success rate. 2, we're going to help the new champions, for Part 1, to understand more about the journey. 3, Part 2, the new candidates, and even all the candidates for Part 2, they will learn from Dr. Franzi right now, and then I will start the roadmap to explain more about ADC journey. Today, guys, it doesn't have that much to do with marketing or anything. Our candidates, they know us very well. They know who we are. The other candidates as well, they have heard about us and they know who we are as well. So mainly to help you, to give you some information how to start your journey. Okay, now, congratulations, Dr. Franzi.
Thank you.
Thank you very much, Dr. Franzi. And from the bottom of my heart, I'm really, really, really happy for you. And I know how much you're a very nice dentist, smart dentist, and I know how much the journey was hard, but finally you completed the journey and then you ended at the best way. So congratulations, doctor.
Thank you very much. It has been indeed a longer road than I thought it would be, but I guess that's how everybody starts out, with the highest hopes. So it will be quick and painless, and it's not. But yeah, I'm here to talk through how it was for me and what I experienced and what helped me, and how the Academy helped me as well with what worked and what did not so well for me. And yeah, hope it
Okay,
helps.
this is really very good. Dr. Franzi, you're overseas right now, right?
Yes, I am. It's actually, hang on, I'll turn on my video. Not sure whether anybody can see me now.
You're on the, okay, let me just check this because give me 1 second, please, just to get to stop the shared file so everyone can see you.
Oh, yeah, sorry, I'm mucking up your plan.
Yes,
I'm
okay,
just
give me 1
doing this.
second. Where you are, Dr. Franzi, where you are, Dr. Franzi? Dr. Franzi.
Oh, don't worry, Dr. Beto, I can just talk. I just did this because it was part of my point with like practicing as well to turn the video on.
Don't worry. I will stop it right now. Yeah, okay. Stop sharing. I stopped sharing right now. So please, guys, while okay, I see you now, Dr. Franzi. How are you going?
It's data. Good, thank you.
Thank you very much, Dr. Franzi. I see you have a little teddy bear in the background. A teddy bear.
Yeah, I'm actually in my godchild's bedroom, so I'm not home at all at the moment. So apologies. I don't.
No, I like it.
Dinosaur.
I like it actually.
Yeah, it is what it is.
Very nice. That's very nice then, Dr. Franzi. Then. Yes, please. Okay, now, Dr. Franzi, look, you're gonna talk on your own. I will be more into listener. Okay.
Sure.
And then I just maybe just I will help you in this part, or actually this could be a suggestion because I know the part one candidate, they actually been here because they want to hear to you. How did you pass part one? So if you can give a little bit brief about part one, that would be great then, Dr. Franzi. First, if you want.
Sure, of course. Yeah, so just a little bit about time frames as well. I started with the Academy, I think, in May, and I had my written exam for part one in September 2024. And that worked out well by literally just doing what Dr. Beto told us to do. It's, of course, lots of reading, and this whole journey can be a little bit daunting. And I just want to tell everybody that this is very much normal to feel that way. And literally everybody who already has children, I don't know how you guys do it. You are all amazing. Like, it's so much extra work that you have to do on the side. But yeah, some people might know that phrasing that it takes a village to raise a child. It's kind of the same with the ADC exam, and the Academy is your village. Like, that's how I felt like as well. With all the materials provided, you have everything at your fingertips that guides you through what you will need to be able to, yeah, answer questions about, obviously. It's the same, obviously, with being already a dentist. We should know all these things, but it's good for refreshment. And the study plans are extensive. And I was always feeling very pushed by what I was supposed to do within one day and all the reading I was supposed to do. I couldn't always finish it, that's for sure. But it provided me structure, and the Telegram group that felt daunting in the beginning because there were just so many messages in one day, and I always felt like, oh, I can't even read all that. It actually really helped me in the end because it depends on your study style as well, what helps you. I know I understood something very well if I'm able to explain it to somebody else, if I'm able to explain it in simple words to somebody else. And the Telegram group was really helpful for that. Obviously, all the sessions are important, whether it's part one or part two, to attend, and also not just the recordings, but actually attend, because sometimes you hear something and you want to ask something in that very moment. So it's good to be present and push yourself, because it is not super easy. Nobody claims it will be, but it's very much doable, definitely. And with the Academy, it's definitely easier, I would say. I'm pretty sure everybody could be doing this on their own as well if they have all the right materials and the right motivation. But what I found was that some days are harder than others, definitely. And then it's easier to have people around you who are going through the same thing, who are preparing for the same goal, and you feed off that. That's a big part of your life, and to surround yourself with people who have the same goal and the same mindset and the same positivity to reach your goal. It's very important to, yeah, get over the finish line, basically. Time frame wise, obviously it's different for everybody. I had my written exam in September. I started preparation in May-ish. I was working on the side. It worked out fine. It was all good. It's probably a little bit frustrating just to hear from everybody there. You just have to read a lot. Definitely, you do. You really have to. But it's good to have the guidance from the Academy. What is actually important, and every mistake that you make in a mock exam question is a fantastic learning opportunity, because you know exactly, oh, obviously I've got a blind spot somewhere, and that's where I then.
You friends, I think the connection dropped a little bit. I don't know, is that my connection or your connection? Guys from the other side, guys. Can you hear guys with a frenzy? No, okay. I think your connection then, guys. That's okay. Give me 1 second. Maybe her connection only, guys. See, guys, she's very nice. And okay, that's fine. Now I can see you again, but we cannot hear you.
Can you hear me now? I just
Yes,
unmuted
we can hear
myself.
you now. Yes. Yes, we can hear you nice.
I'm so sorry. I hope it's not my connection. Sorry about that. I'm
That's
not
okay.
sure
We're
where
all
I
gonna wait
cut
for
out.
you, Dr. Franzi. That's okay.
I'm so sorry. Yeah. I'm not quite sure where I cut out. I'm going to keep it short. It's
That's okay. We are here. We're waiting for you, Dr. Franzi. No stress. See, guys, the good things you need to suffer for it. That's why we're suffering now for Dr. Franzi. Okay. You need to do effort. I think the connection. Dr. Larry, you want to talk, huh? Okay, where's Dr. Larry? Hi, Dr. Larry, how are you going?
Oh, I'm just too happy for her.
Dr. Franzi is there and you, Dr. Larry, together.
We always talk, so yeah, this is.
I know.
Yeah.
Okay, I
I'm
will unmute
so
you, Dr.
happy.
Franzi. You need to unmute yourself. Okay, Dr.
there
Franzi
we go.
does
I might just turn my video off. I'm so sorry because something is not going quite right, and it's my cousin's internet connection. So she's in trouble now. No, she's not. Sorry about that,
No,
guys.
everything's fine then. Everything's fine. Everything's fine.
I'm not even sure where I cut out. Hi, Larry. Miss you heaps. Um, yeah, so I was just quickly talking about obviously all the reading that's important for part one, and you will be able to get everything.
I think it's a connection. To use laptop or an, I think it was supposed to be laptop. Okay, guys, just we're waiting for Dr. Franzi again because she's overseas. And then maybe the connection not the best. We're waiting for it. Maybe it was good if the connection dropped completely from her side, because that means like she can restart her network, which is going to be a good idea. And that would give a better quality. Okay, guys, again, this class, just give a brief about this class. We have 3 parts in this class. The first part, which is, this is more about part 1, Johnny, and then Dr. Franzi will give her experience. And then the second part is will be for again for our champions who has just recently passed the exam, or all champions who has passed part 1 exam, and I'm very proud of them for the highest pass rate they have achieved. And then the third part, which is a roadmap. So Dr. Franzi will actually by herself give you guys good experience about part 1, part 2, and then me and Dr. Alifia and Dr. Anne will be with you guys through the part 2 journey, how to start it as a part of roadmap. For me, as I said, I will not be tired today. I'm with you until I get all your questions. I clear all your doubts. It may take a little bit of time like this, but finally, guys, I'm going to make everyone happy. And then, guys, you will learn as much as you want, either about part 1 or part 2. Okay, guys, you know what? Once, while Dr. Franzi is joining us back, guys, if you have any question for part 1, you can ask right now, because we're still on part 1. And then definitely after this, we go ahead with part 2. So guys, if any champions has any question about part 1, the process, the journey, you please guys, you can ask us right now until she's back again. Dr. Larry, do you want to do role play now? I know, like maybe Dr. Larry, Dr. Amna. She's like, really? Yes? She's back? Okay, Dr. Franzi? Yes, I can see she's back. Okay. Yes, all friends, try now to talk. Dr. Sanchari, huh? Role play as well? Okay. Yes, why not? We do it now. Please, guys, if you see any questions on the Facebook page or here, please let me know. Okay, guys, tell you something. While we're here right now, Dr. Euclid. Okay, there's some questions here. Very good questions, guys. There's a question here, Doctor. Can you tell us how exactly to study? I have a brain and patient that can study. Wow. Ooh. I'm telling you now, Dr. Ravori, if you're really a dentist who can read and study for 10 hours, I can tell you right now, you're definitely going to pass the exam. Okay, so now the question is, can you tell us how exactly I can study? I have brain and patients that can study 10 hours straight, but I'm not sure I'm doing it right way or not. Dr. B, do help. Dr. B, do help. Okay, Dr. Ravori, admit first Dr. Franzi. So Dr. Ravori, so what we need to do is there is a plan. Based on the plan, we just go, as Dr. Franzi mentioned, you need just to follow the plan. Sometimes you'll not be able to finish all the plan because I do this in purpose. In purpose, I give you a little bit more than the average. Why? Because there are candidates like you, they can study 10 hours, but this way you can finish the plan. Other candidates, they can only study 1-2 hours, most probably will not be able to finish the plan. But no worries at all. Why is this? Because I push you toward to get the best level ever, right? And then that is you're going to cover as much as you can from study materials. And next stage, we're going to repeat the same things again. You will find yourself, oh my God, I already did this before. It's just only 20% left, 30% left. Let's just cover them now. And then you will find yourself perfect. As long as you read and study what we give you, especially Be Delicious, because you're lucky guys, you got Be Delicious in the beginning, some of them, not all of them, and Diamonds and Beetle Bites. I believe this is going to put you on the right track from the beginning, plus my lectures. Dr. Franzi, are you there?
I am back and I'm back on mobile data. I ditched the Wi-Fi. I am so sorry.
That's okay. It's all good then. No problem. Okay, Dr. Franzi, we hear you right now. It's all yours.
You
No
finished my point perfectly. It just gives
Yes.
you a good push. And the short version that you are very lucky to have from the Academy ticks off all the boxes, what you need to know in detail, so you know exactly what is being covered for the exam. And what helped me as well, and what I found in my exam, what was happening as well, was just getting the big picture, getting the concepts of a safe approach, what is pro-patient, and what is considered safe in Australia, and always considering that this is a Western country with Western values, and this is something that comes up sometimes in questions as well. So just staying calm and reading the question properly, reading it twice, thinking about the keywords, everything that the Academy tells us as well helps a lot. Am I still audible? I'm just double checking.
Yes, you are audible. You're totally audible.
Fantastic.
I can hear you.
This is working now.
Yeah, it's working. Yes.
Perfect.
That's why phones sometimes they use like a little bit of data than the laptop, I believe so.
Yeah, my tablet is not doing it for me today. So yeah,
That's okay.
perfect. And yeah, just with the exam structure as well, what I found very helpful is not to doubt yourself too much when you are sure about a question. Leave it. Don't touch it up when you thought like, oh, this is making perfect sense. This is very logical. Don't go back and circle over it 4 times and change a right answer to a wrong one in the end because you're getting nervous at the end. Only flag what you're not sure about and only look at those to check again. When you're sure about something, trust yourself. You know how to approach questions properly when you're following things that also the Academy told us to do, but also like, yeah, just reading it properly. And housekeeping wise, do things that fill your cup. for part 1 and part 2, because that's something I think that a lot of people struggle with at the end of the day, that this is all very tiring. It is all very stressful. A lot of things depend on it, of course, and all these things can be draining. So have a good support system. Tell your friends and family that you're doing this so they can support you in what you need to do. I try to delegate things that are not needing my personal attention for the time being, that somebody else might be able to do something for me for a certain time. So I actually have the bandwidth and the energy to do what I need to do. Prioritize your sleep, eat, all these things, but do something for you. Like you're the only one who knows yourself what you need to do to maintain being able to do this properly. Like, yeah, I think that's a very important thing to stay motivated. And that's all I had for part 1. I'm sorry that it's so short. There's no magic trick to it, but the material and the structure provided is successful, and I think everybody who follows that will be able to do it. And setbacks are normal, but keep pushing, and you will be able to do all these things.
Thank
Am
you
I
very much,
still
Dr.
audible?
Franzi. Yes, yeah, you're audible. Yes, definitely you're audible. And thank you very much for this. For is this all for part 1, or do you still have some information for part 1? We still definitely whatever. Look, guys, whatever Dr. Franzi can mention today, that's gonna be help, because part 1 exam and part 2, they are related to each other. By the way,
100%.
yes, Dr. Franzi.
Everything that you revisit from your previous studies for part 1 will help you with part 2. You will not forget that. Everything that you revisit makes you a better dentist. And remembering that as well when you're frustrated and when you're unmotivated. You chose this before, you're choosing it again, which kind of is a big deal, because it's easy to like change your mind about something that is not really important to you, and doing something that you love is the best motivation that you can have for yourself, for your family. And yeah, you're choosing it again, so that's pretty awesome.
I totally agree. And there's Dr. Franzi. I still hearing you.
Perfect. That's actually all I had for part 1, Dr. Bedo.
Okay. Well, let's see if there is any questions from part 1 candidates. Okay, let me just check right now. Okay, guys, please, guys, you can ask either on Facebook or you can ask on Zoom. But Facebook now it's handy. I can now see the Facebook by myself.
I can see a Zoom question here.
Okay, you can start with Zoom then, Doctor. Facebook.
Yeah, okay. How to deal with questions that have similar answers. I always looked for the keywords. Like, obviously the question is asking for a particular thing. They are all similar. Like, the ones that are obviously wrong are, like they're flying out the window, but you're usually left with 1 or 2 that are kind of right, but only one will be obviously 100% right. And it's always looking for the keyword. What is actually the question, and why that answer then is making it more right than the other thing. Like, it's about these things when something easy, like never, but learning how to scan the question for the keyword that will help you with figuring out what is the right answer.
Yeah, totally agree on this one.
I think you trained us quite well with that. Dr. Bedo can probably explain this best in his own session. I've got another one here. What are the things that we must do on a daily basis, like TG, and what else? I think being consistent is the most important thing. Like, whether you stick to the exactly daily plan or what is left over from your day before, I would revise. I think Bedolicious it was when I had my attempt. I would go through that, and then from this I would check, where do I have to read more? And I would, even when I don't know something, go for articles and just read that up on my own as well. And TG is the most important thing. If you are running out of time and you don't have much time left before your attempt, or you're just trying to get as much ground covered on a day, the material, that is shortened is your friend, and TG is the most important structure that you need to follow, and read it more than once, definitely.
Yeah, Bedelicious is an easy version of TG and the most important book. This is Bedelicious. I know you haven't had Bedelicious at your time, but this is Bedelicious. And it has like the most important things. In your time, I think Dr. Franzi was a cake or diamonds, seems like, because that's the first time I started to provide my
It was
notes.
diamonds, Dr. Beto. It was diamonds.
Diamonds at your
That's
time, yes.
Yes. I did use
That's
the other
right.
stuff as well later, though, when I wanted to revise something. So it comes in
Yes.
handy.
The diamonds, huh?
too.
I'm very happy that they
Definitely.
even help. I think diamonds even help in part 2. I believe so. It can help in part 2 as well. Okay.
How
Do you
to
have any
choose out
questions
the
from your side,
practical.
Dr. Franzi? Yes.
There's another one, how to juice out the practical and well-needed concept out of any article or notes reread. I literally used it with the mock exam questions as well, that when I found, oh, I got this wrong, why did I get it wrong? Like for example, in whitening, I felt like I had a gap there. Then I would just get a proper source, whether it's from Australia or the UK, or even like get a YouTube video just to cross-reference that and try to get the information in, and then I understand the proper answer. So I would use that. Where am I missing something? You obviously have knowledge about certain things already, but the questions sometimes tickle out that you didn't get it properly, and that I would use to just get the information that I needed. I hope that answers that question. And this is all I can see here on Zoom, Dr. Beto. I'm not
Okay,
sure
let me
whether
just
there is
refresh
more.
here. Seems like the candidate they know everything right now. Don't have any confusion then. I'm very happy for this. Let me check the Facebook.
Maybe I'm
And just
talking
to
too much.
share with them. No. Yeah, we give them enough information then. Okay, let me check now if there is any.
Article or notes reread. I literally used it with the.
Let me check now if there is any.
Or notes reread. I literally.
So, Dr. Franzi, are you there?
Mm-hmm. I'm
Yes?
still here.
Yeah, okay, that's fine. Do you have any question from your side?
There is nothing left here in the chat from
Okay,
what I
my
can
side
see.
then. I will check from the Facebook now. So, everyone says congratulations to you.
Thank you
I see
very
now
much.
lots
Guys.
of congratulations here. And then, okay. Hello, Dr. Muhammad, everyone. Hello, guys. Okay, a question. I have a question about cluster in part 1. I attempt the mock and find myself doing good in some clusters and not passing in others. How to proceed in my prep, as overall passing is crucial. What do you think, Dr. Franz, about
That
this?
is very true. I would literally go by question, because I think in general, like it depends obviously on the cluster as well, whether what is being the problem, right? Like if it's for diagnosis and management, like all these things, look at the topic of what you are getting wrong, like in particular, because obviously it depends on the question, and fix it right there with that question. Like that's what I try to do, because I did not fail my first attempt. It was a pass, so I can't really talk about my first attempt, what was different from my second attempt. This is what I did with every single question, no matter what the cluster was, trying to fix when I got something wrong. I'm sorry if this doesn't really answer your question, but I would literally try to eliminate every single mistake I made. There will still be something that you're not getting quite right on the exam day, of course. But yeah, I followed basically that system to get the bug out. Yeah.
Okay, I may help in this question as well, just to add a little bit this. So totally, Dr. Franzi, you're right, because I believe the same. I seen candidates, they couldn't pass in the first attempt. And in the second attempt and asked them, what did you differently? They said nothing. I just only found myself. I learning more for the second time when I studied. I grasped the information much better than the first time, but it was mostly the same things. I said, okay, that's great then. So in this part, I may suggest something, which is you don't doubt yourself. Don't keep looking behind too many things. Just only take it easy. Try to practice again, but ensure what you're doing is actually perfect in good way. And also, if you have issue with some clusters, I put my materials in cluster wise. For example, if you're going to check my study materials, you will find these days I give you trauma guidelines. I divided trauma guidelines into stages. I give you the first notes, that for information gathering and diagnosis and management planning. And then the second notes, it's trauma guidelines, but more into clinical treatment and evaluation. So in this case, you have an issue for clinical treatment and evaluation cluster, for example. So when you study my notes, ensure you focus more on the clinical treatment and evaluation part. Same exactly. When I do the weekly plans, I put the weekly plans based on clusters. You will find this. When I give the notes how to start the subject, I tell you every subject it has 4 sections. It has professionalism part, and in this subject you need to focus on 1, 2, 3, and 4. And I do the same things for every single cluster. So guys, if you really want to improve yourself, you can go this way if you want to really improve yourself in a specific cluster. I hope it's clear right now. Thank you very much. Yes, please, doctor. Okay, I may have more questions here as well.
Yes.
Okay. A question from Dr. Rosa. Dr. Rosa, I always say I like her name. Hi, Dr. Bido. I used to study through books. Can you guide me which books other than TG to study, as I am away from studies almost 10 years? What do you think, doctor? If you want to answer this question.
I started with that as well. I literally went to the library in Melbourne and got the books off the list from the ADC. And then I had a pile of books at home and just thought I wanted to cry. I read 2 of them back to back, and I personally don't think that this is viable to do it like that, because there's just too much to read and only so many hours in the day. It's not university anymore, so you kind of have to sift through what is being covered. And of course you can do it like that, but I think it is actually easier to follow a study approach that is boiled down a little bit. You know, TG is boiled down. It's not a thick book. You can read it back to back in a day, and then from there pinpoint certain things. And obviously there is material provided by the Academy as well, that you can use articles to all the different topics that will need to be covered. And it's already a lot of reading as it is. Yeah, and I honestly, I didn't read that many books. I focused on articles if I wanted to dive into something deeper than what was provided. I hope that answers your question. I did give them back to the library.
Still friends, yes. Okay, now I may add a little bit more here as well. If you really study books as books, you can study books from the ADC material source list, and then you will find books. For example, you can study books like Carranza, Imperio, and you can study Mountain Human Restorative, Operative, and then you can study Dr. Cameron, the whole book for pediatric, and Dr. Peterson for surgery, and and then for X-ray, you can I think they suggest as well Dr. Cohen book, and Malamed for LA, Dr. Cohen for endo, Stephen Cohen, and then yeah, these are the books. Some of the books there you can go through them, but the only issue is if you really can go through them and then you can revise them before the exam, that would be perfect, definitely. Okay.
Yeah. And Odell as well. The cases by Odell, they are very helpful because it literally is a whole ride through dentistry with everything that you can come across in the practice, and it's a good practice for part 2 as well because it's a case discussion that is similarly structured, with differential diagnoses and all these things that I found very helpful. It was a good fresh up as well. Like, but at the same time, like if you are struggling with time, they are boiled down things that you can do. And if you have extra time, of course, all the material like that. Like for me, part 1 has been a while, you know, like my preparation for part 2 obviously was different, but I did have that material at home as well, and I sifted through it. I had enough time to do that as well, but closer to the exam, definitely go by what Dr. Vito said. Yeah.
Okay, I think we have a couple of questions here. Maybe I will answer them answer them quickly right now. This is the okay. So there's a question from Dr. Winnie and Dr. Omem. Okay, how helpful were the articles in your prep, Dr. Franzi? As okay, that's for you, Dr. Franzi then. As they take up most time to go through articles.
I found that was shorter than reading the book according to that topic because they are extracts as well and abstracts. So you can read a short version as well and use the search function as well to look for the information that you are looking for. So you can boil it down yourself as well when you're revising, when you're going through articles to scan for the information that you are looking for. Like
And this
how
time
a
also
study
Dr.
is
Franzi
designed
as
does
well.
not
Yeah.
interest me, you know, like
Uh,
in that sense, how the study was designed does not interest me in that moment.
And by the way, now even we don't provide them that much. I removed most of the articles, most of the books, and then I actually replaced them with Be Delicious, and because I bought everything in Be Delicious. Okay.
Yeah.
A question from Dr. Winnie. I'm trying to follow the study plan, but it's really hard to finish up. That's definitely yes. Any tips, please? Look, you want to be able to finish, Dr. Winnie. I'm just in the truth because we are different. I made this plan for the candidate. They can study 10 hours, 12 hours. Why? Because I don't want to waste anyone's time. So if there's a candidate who is willing to study 10, 12 hours, we'll be able to finish the plan. What if someone only can study 3 hours? That's okay. 1 hour, that's okay. 2 hours, that's okay. Because finally, we're going to repeat this one again. Okay? This is normal. Since the beginning, Dr. Francis said the same things. Everyone said the same things because I don't want to really feel sorry for the candidate. They want to study more. But if you study less, that's no problem because as long as you do your best, next stages, tell you something, the last month in the preparation, the most important thing. I'm not saying this just to make you lazy right now, but anyway, you must do your best right now in the study. The last 4 weeks before the exam, this is the most important part. Anyway, Dr. Sayeda, how did you manage your time? And please give us some tips to handle our stress level. Okay.
Yeah, that's a big one.
Yes, please. That's a good one.
Definitely, the stress level is a big
Sorry, Dr.
problem,
Franzi, I want to
obviously.
say something. Dr. Sayeda,
Yes.
she scored 80% in her last mock exam after 4 mocks. Like she started only this batch. She never did the exam before. I think she told me the first time she scored about 30% or 40, and then a little bit more. And this time was really hard mock exam, and she scored 80%, which is I think one of the highest. So she's doing very good.
That's awesome. Congratulations to that. And you're obviously doing all the hard work. Managing your stress level is something that I wanted to talk about, in particular, talking about part 2 as well, because that's when I had a little bit of an episode where I could not perform anymore because I was putting too much pressure on myself and I did not handle my stress very well. So prioritizing things that recharge your battery is very, very important. Obviously, we want to be motivated. You want to put in the time. Just like Dr. Beto said, I felt the same way. You can't finish the daily plan. Even when I had a day where I was able to study 10 hours, I still sometimes felt like I had things left over. And that was daunting at times, but at the same time, you need to prioritize, okay, can I do more now just by doing more on that day? No, you can't, because you still have to eat properly. You have to see the sun at some point. You have to spend time with your family, whatever makes you happy as a person, that you are actually able to be the best version of yourself. You still have to maintain and do all these things, because otherwise just studying, I mean, everybody's different, but I'm not like that. I still have to do something for myself so I can perform the way that I would be performing when I would be with a patient, when I would be actually working as a dentist, because this is going to take a long time. So your time management, basically just sectioning your day. I'm going to read for X amount of hours. I'm going to do mock questions for another hour. Then I will have a break. I will have a cup of tea. I will go outside. I will spend some time with my family, and then I will do another 3 hours. Whatever you get done in this time, and you know you have maybe a productive day, you maybe might have an unproductive day, but showing up for this every single day and being consistent with it while maintaining your battery is the only thing that you can do. The day is not going to expand for you. You still have to section it and prioritize information over other things as well. Like, you have to sift through the material when you don't have much time left on the day. Read Be Delicious. Read something that is shorter and finish that. Have your successful moments with it that keep you motivated to be able to continue. And the mock exams are relatively quick if you're doing them at home, obviously, because you're not having a computer. I mean, yes, you have a computer, but you're writing it down, right? You can go through it at your own pace. Have something successful that you finish the day with, that you actually finish, so you are motivated for the next day, and show up again and do it all over again. That's what I did.
That was great, and thanks very much. Okay, Dr. Franzi, right now. Part 2. Look, guys, for
Yes.
everyone who's attended for part 1, definitely you're going to get lots of information about how to study, because again, part 1 and part 2, they are somehow connected to each other. So now, Dr. Franzi, part 2, what do you think about part 2? What did you do? What specially you have done for part 2?
First up, I found it very overwhelming in the beginning. I want to say this is very normal. I don't think anybody else is not having the same feeling with starting out. Same thing again, I found it very helpful to talk in person or via Telegram with other candidates that have already started this journey. Talk to each other, because yes, every material is provided. You can read the handbook for part 2, all these things, but having somebody who boils it down for you, how this exam works, what the structure is, how the class structure is, will help you and make it less daunting, especially in the beginning, while you're trying to find your footing and what works for you. And what works for you might be different from what works for others, so it's worth putting in the time. I started with communication OSCE, because that's something that you can start right away when you do start, because you're doing it from home, you don't need any material, but at the same time, start ordering your stuff for your home setup. This takes a long time.
Sorry, Dr. Franzi, can I interrupt you for a second?
Of course.
Please, guys, my champions, because most of you are my champions, please, guys, pen and paper and write down this stuff. Please, guys, pen and paper, all our champions, write down this stuff. Yes, please, Dr. Franzi, sorry. Keep going.
Yes, no, of course. Very true. Have a pen ready at every single session and join all the sessions as well, because especially when you're getting started, there's just so much that you haven't even thought about this until you're passing your part 1, obviously, because this is like this major step, and then you passed it, and then, okay, what am I going to do now? So ordering your material takes a long time. Setting up these accounts, figuring out which dental depot is going to ship to you, all these things. And then until it actually arrives is a whole different story. So use your time sensible. Communication OSCE is something that you can start with at home while you're figuring out all the other things. Obviously, material is provided. I found it very confusing. I'm going to be upfront with you. I found it very, very confusing what is happening, how these rooms work in the exam, all these things. And talking to somebody makes this easier. There are candidates who have done it before who might be preparing for their second attempt. All these things are great for you in that sense without being spiteful that somebody is redoing it, but somebody is sharing their experience with you, and you can basically go through this together and learn from that. So talk to each other. Telegram is really important. The tutors are there for you. Attend the sessions, because that's the only way how it becomes clear. And being there in person in the session is important as well. A recording doesn't answer your question when it comes up. Your peers will, the tutors will, when you are actually there. And showing up for these things, just like part one, showing up every day for what you want to achieve is important. And doing it early on. Obviously, everybody wants to recover a little bit after a big milestone, but getting the ball rolling earlier is you're in the treadmill, you're all rallied up from part one. All this knowledge is still inside of you, fresh, and like part one is so important for part two. You studied well, you passed it. All this information will be regurgitated for part two. Like all this knowledge is still there. So get started, get your ducks in a row, and get going, even though you might want to rest a little bit. Study partners are very important from the very beginning. I was very fortunate that somebody approached me because I was not very social. I'm going to be honest, I didn't want to just ask somebody, oh, do you want to do that with me? I found the whole role play thing uncomfortable, like this is not really my personality. I did not feel comfortable acting this out with somebody that I don't know. You have to overcome that, and you need more than one. You need to talk to different people as well, because different people pull you up on different mistakes as well, because you will get comfortable talking to a friend. You become friends, and that's fantastic because you've got a friend that goes through things with you, but you need to be a little bit uncomfortable. You won't be more uncomfortable than on your exam day, and to be properly uncomfortable in a safe environment that will not fail you is doing the role plays with the tutors, with Dr. Bedo, with exposing yourself to this uncomfortable situation that, oh, what if I say something stupid? What if I use the wrong word? When 100 people are listening to you, that is a daunting thought in my head. It's a daunting thought right now, but you just have to get through it, because on the exam day, there will be 2 people sitting there judging you every single word, judging everything about what you're going to say. And exposing yourself early on to this construct will make it smooth when you're doing it for the second time as well, because I did fail my first attempt. So I passed my written exam in September. I had my part 2 exam, let me think, in June of 25. And I had planned this out, all the wrong things at the same time. We were getting married 2 months later. I don't know what I was thinking, my bird brain. I was putting too many things on my plate. I was doing a lot. I was putting in all the hours. Yes, I was doing a lot. I was doing the right things, but I was overdoing the things as well. I did not give myself rest. I did not de-stress. I didn't do what I was saying previously to fill my cup, and then you end up in a spot where you can't perform. So saying all these things is not meant to like making you think that this is a horrible experience. It is not, because the exam, honestly, I was really impressed just with I'm not going to talk about my exam in detail because this is not what it's about, but these people know what they're doing. They're very nice. They're very well organized. They want you to perform your best. So you don't have to be scared of them, but this being uncomfortable in these situations, this starts early on with preparing for it. And by doing it early on, doing the role plays, this prepares you very well. So do it early on, put your hand up when there is a spot freeing up, even when spontaneous, when you haven't prepared the case because you're coming home from work and it's late and you're tired. You can still have the opportunity to do it with the tutors, and that is great, So do it early on, get comfortable with being uncomfortable. That's, I think, my biggest advice. I had more than one study partner for my second attempt as well, which I think was really helpful because you get comfortable with a person, and I would probably make the same mistake because, you know, I'm just being the way that I am, but it's not maybe ideal. So being with different people that pull you up on different things is very helpful because you will have different examiners as well. Attitude wise for the whole process, being a good clinician means listening to your patient, being concerned about their concerns, about their feelings, about their pains, all these things. And the empathy part in the OSCE is the major important thing. And that's something that you have to learn as well, that you're smiling through your OSCEs, that you're actually making your face smile so you can hear it through your voice that you are caring about the other person, even though this is a role play and it's really weird. I think that's a big thing that you have to do, which was the reason why I wanted to turn on my camera initially as well, because that's something that I started doing later on. Put your camera on, look at your face, let the other person tell you as well when you're looking down, when you're not making eye contact. It's not comfy to be on camera, but they're gonna look at everything. They're gonna look at you as a person overall, and that's what it's about. And exposing yourself to that makes it easier. You know, you're gonna be calmer. It's gonna become muscle memory, and you're gonna be comfortable when your exam day comes. Made some notes and I completely went off track. Sorry about that. That's what I do. That's what I was one of the problems as well in my OSCEs, to stay on track. That's how I prepared as well for the OSCE stations. I would read through all the material. I would get organized myself. And then for certain terms where I realized I was running out of time because I was rambling on about periodontitis or explaining what a pocket is, I would try to boil this down, being pulled up on it, like this was not clear when you were saying that, I did not understand what you were saying, or I was losing a lot of time because I was using 3 minutes to explain what a pocket is. This does not help you. So being pulled up on your mistakes, and then you can fix it. So I would boil down what I wanted to say. Certain things come up time over time again. I would make myself memory cards. This is how I want to explain what a pocket is. This is my analogy. This is what my study partner mirrors back to me. Or this is actually, this makes sense. Use your husband if he's useful for that, whether or your partner or your family member. You know, was this understandable what I was just saying? Because you're supposed to do it in layman terms. You're not going to get anywhere if you just use jargon. All these things, you know. Be comfortable with making mistakes while you're preparing, because then you're not going to make these mistakes in the exam. And familiarize yourself with what you should be saying in each cluster. Be aware what is asked from you, what will get you points in this role play, and stick to that. Do time management, time yourself, put a timer on when you're explaining things. How long did this take? How long did I take for each part of my role play? And continue doing that early on, because I was doing these things a little bit too late from looking back on it, that I could not pinpoint where my role play went sideways when I was not finishing a case, for example. You know, you're listening to me right now. I talk a lot. That's how I talk.
We listen to you, doctor. I listen to you, and everyone enjoys your journey.
Yeah,
Everyone
but
enjoys the
you don't
experience.
have this time. You know, you don't have this time in the 10 minutes. You know, give me 30, give me a cup of coffee. You know, the examiner will be happy with me. You know, but I don't get 30 minutes. I get 10. So I have to get the stuff done that is asked from me in that
And you know
scenario.
what, Dr.
So
Franzi?
yeah.
This is exactly what I was telling them yesterday. And sometimes when I tell the candidates, they don't believe me. And they think they really want to, like, last time, even we have Dr. Email. She said the same things to everyone. But still, even the candidate, when I told them, they won't really explain a lot. Say, why? Like why? Even today, when I assess them, maybe you're still in Telegram group, the private Telegram group for the candidates. When I was assessing them today, there's Dr. Sama and Dr. Sanchari. Both of them, I said, guys, just say this only. That will be enough. No, as you said, exactly as you said right now, you don't need to explain the pockets in details on this stuff in details. Just only simple things, very simple things. Be direct,
Yep.
easy words, and that's it. What do you
Yep.
think about this?
Definitely. And the thing is as well, it's about how you carry yourself and whether you address the patient's concern. Because in the scenario, it's always like that. There's a main concern. There's a bold part. If you address this head on, very direct, they know you've got your ducks in a row. You've got a
That's right.
concept. You are carrying yourself a certain
You're
way.
very smart,
And
doctor.
if they had a question, they would ask it. And they don't when they feel like, oh yeah, she knows, like they're not going to ask you. And
Definitely.
I had
That's normal
trouble.
happen in the clinic.
Yeah,
That's normally happen with the patient, Dr. Franzi. That's exactly happening like this in the clinic, and then that's what we do always in the clinic. So you're totally right
yeah.
about it. Dr. Franzi,
And
now if I just want to ask you a question right now. Let's say
yeah,
back, just try only with back memory, right? If you really want to start, if you're going to start the journey, how you started, what you're going to start first, OSCE first or technical first? What are you going to do? Put yourself as if back again with the memory. You just passed part one right now. Tell please everyone how they can start.
I would start with OSCEs first because you got the material at your fingertips for it. You can start that from home. I would start with OSCE first, sift through the information while at the same time gathering everything for your practical, for your home setup, all these things. Get organized. I did the on-site course as well because I need structure sometimes, Like I get easily overwhelmed if it just looks like a lot and I don't know where to start. And that really helped me because I was feeling like I've got a structure at hand. I would start with communication OSCE, getting all your materials, getting your home setup started, and then starting with practical, of course, as well. I would also say with skilled OSCEs, familiarizing yourself with that early, getting the material for it early, because I was starting with that way too late as well. And it was stressing me out a little bit towards my first attempt as well, because I kind of had it on the back burner. Oh yeah, it's gonna happen, but the other two things I need to do properly first. I was really worried about communication OSCE because I felt like I was putting myself on a stage and I felt really insecure about that. And then everything else became like an afterthought with the skilled OSCE part. But it's 4 rooms. You got to do them. So do them early, do them as part of your practical preparation every day. Like have a structure in your preparation to do them early so they're not gonna be like a thing that you have to do like the week before the exam because you felt like you didn't do them enough.
Very good. So do you recommend online technical or on-site technical?
Well, I did both. I did pass my written exam in September. I did my on-site in January, and that was basically how I started my practical journey altogether. I did my practical on-site before I even did any practice, because I wanted to get a feel for the jaws. Everything is different. Like I come from Germany. We use different models. We use cable. It's nothing like the Columbia stuff. I wanted to get a feel on how to do it properly from the beginning so I could judge my own work at home better and then be more comfortable with the online technical feedback and everything because I already know what I'm looking out for. But I'm going to be honest as well, like I feel like from my first attempt to my second attempt, I became a lot more critical about my work as well. Like be ruthless with yourself straight away, like don't continue as in like, good enough, I'm going to fix it later. It's just going to bite you in the bum. That's just the way that it is because fixing a matrix, even when it's fixing a matrix for 15 minutes and it's annoying and you want to move on, it's going to be a lot easier to fix that matrix rather than fixing your filling afterwards. So pay attention to each step, familiarize yourself with the criteria, what is asked from you for each task, and review your work at every single work step along the way, because it will just make it a lot easier to get to the result that you need to have a passing grade for each single task in the practical.
That's very good then.
Yeah, with
Doctor, for home setup, because there are lots of candidates they ask for home setup. From when did you buy your home setup, and what is your recommendation for it? And how? How would you do this as well?
Yeah, I think I would do a few things maybe different, because I thought I was late to the game with getting it all done. I ordered most of the things new from One Dental, but obviously you have a village at your fingertips. There are candidates that pass the exams that have a whole setup for sale already, maybe close by to you, which is worth exploring. Obviously, you get the material list from the ADC as well, what is provided for the exam. That's the same things that you should be using at home. Of course, you can use different brands. That is fine. I think especially when you're thinking about cost for everything, if we were all millionaires, it's going to be easy. You're just going to order everything from One Dental and you're done. But of course, that's not going to be a very cost-effective way of doing it as well. And
do you have any recommendation for the other brand as well?
Dental
Did you
Market.
buy from other brands? From where?
So the Dental Market is a good one as well. That's where I bought my dental unit from, for example. I bought sets from One Dental, and it depends as well on how you're starting. Looking back on it as well, don't stinge on ordering material, because you think, oh, do I need all these teeth? Yes, you do. You really do, because you're going to go through so many of them. In the beginning, while you're figuring out how the jaw works, how loose the screw is, how tight the contacts are, all these things, while you're getting yourself sorted, I think it's totally fine to go for cheaper teeth from One Dental or Moy or whatever for the time being, because you're going to make mistakes in the beginning. It's not going to be perfect. It's not going to matter that much for the initial stages of getting organized. I think there you can definitely save some money, go for a cheaper option rather than the One Dental teeth, and practice on those. I would say as well, like, take your old fillings out after a while, reuse the tooth while you're getting yourself sorted. But closer to the exam, you need the original materials, the exact same stuff that is going to be used in the exam, because you should not get used to something that is different from your exam experience. It might be easier than if you're having shitty material at home, pardon my French, but you should have the same setup as the exam. Don't give yourself too much space. Have a look at the provided material by the ADC as well, how your workstation looks like, and try to mimic that in your whole setup at home. Don't give yourself huge tables to spread out all your material and get super comfortable. You're going to have limited space. Try to mimic that in your home setup. Get a good lamp. Look at the lumen. Get something from the hardware store. I can provide a link as well maybe later on. I got a really good lamp that was adjustable that you can kind of use like a headlight. It's a desk lamp. Stuff that makes your life easy to that degree that you can probably see and work, but it's similar-ish to the space.
Do you know
and
what,
the
Dr.
setup.
Franzi? I really like you
Yes.
very much. You go in details, like in very deep
Yeah,
details.
too much.
Very deep details, even the lamp. Imagine you think about it as well. You're very good.
Yeah, I love my lamp. I really love my
Yes.
lamp.
You really go and find details. Okay.
Yeah.
Dr. Franzi, we go now because I need your help in this part as well. Me and you and Dr. Alethia and Dr. Anne. We're going through this structure and I need your suggestion as well. Because there are lots of guys. I know, guys, most of you here right now, you are the champ. You are March 2026 exam champions who have passed the exam. And now you are just willing to start the journey. And I believe some of you as well here, they are just existing seniors for part 2 exam. So, Dr. Franzi, we can go this structure together, me and you and Dr. Alethia. And by the way, guys, you can get this plan or this structure from Dr. Lama. Please, Dr. Lama, if you, because I know there are some candidates, they just joined right now. If you can send the link, Dr. Lama and Dr. Leah, If you can send the link so the candidates can text you and then you give them this file, that would be great as well. So Dr. Alifia and Dr. N, how are you going, guys?
Hello, Dr. Mido.
Is that who? Is that Dr. Alifia?
Yes, that's me.
Okay, Dr. Alifia.
Hello.
Dr.
Hello,
Franz is here
everyone.
as well. Congratulations, definitely.
Yes, I heard everything what Dr. Franzi said, and it's like nostalgia for me because when you were in the academy, like, you know, all the things which you went through. So you said you were here, I think, in the academy in January, right? Jan
Yes.
2025. Yes. I definitely, I really well remember your when you were there in the course. And I always admired how, you know, how you were so structured with the way you wanted to learn things. And I always told Dr. Bido from day one that, you know, because me and Dr. Bido, obviously we talk, even in the academy when we see students, we can tell who's going to pass straight away and, you know, what people's weaknesses are so that we can work on them. And I always told him that you are such a smart dentist and you definitely deserve to pass. And here you are, like an inspiration to everyone. So thank you for being here with us. And thank you for sharing your lovely, lovely experience about, and obviously because I met you in the academy and then I didn't see you for a bit, so I did not know about all the things what you went through as well. And it was really good hearing from you, your journey as well. So thank you for sharing that, Dr. Francie. And
Thank
Okay.
yes, and I would love to congratulate everyone for part one who's here. I didn't get a chance to congratulate every one of y'all. I am so excited that you'll have cleared the exam and you'll are finally going to be with us for part two journey because I don't see y'all much in part one, but I will see y'all a lot in part two. So I'm really, really excited to meet you all in the academy or even online, and really excited to help you all as well.
Okay, that's a great
Thank
then.
you.
Okay, guys, let's start right now. So, Dr. N, how are you going as well? Okay, Dr. N, she's just
Hi,
maybe.
now I can unmute myself. Sorry, I
No,
was
that's
dropped
okay,
from the
Dr. N.
meeting.
Good.
Hi,
Thank you.
Doctor. I'm good. Hi, Dr. Alicia. How are you? Hi, Dr.
Thank
Francie. Congratulations. You deserve the best. I'm
Thank
very
you so
happy to
much.
see you on the other side.
Okay,
Thank
guys.
you.
So, guys, this is gonna be a start, I would say, because when I was thinking, actually, with the team, with Dr. Alifia and Dr. Ayan and the team about this, we found out it's too hard to explain about part two. We could actually do this, or we can do this, to explain everything for part two in one time, but you may still confused. So that's why we're gonna take things very easy and simple to you. And we're gonna do another session that's gonna be this Sunday and will be mainly for home setup. We're gonna give you some important information about home setup today. Especially we have Dr. Franzi here, she can help us in this, and Dr. N. And then Dr. Alifia. And then guys, we're gonna have a complete, which is say we're going to resume or continue on Sunday with whatever left over from this session, which is gonna be on home setup mainly. So now, I imagined myself in a situation that I just passed the exam the last week, like as every one of you. So I need to understand what exactly the exam about. And then exam part 2 practical ADC part 2 practical exam will be mainly consists of two main components. One, which is a technical skills day, and then two, OSCEs, which is communication and the clinical skills. Is that guys clear so far, guys, to you? Please, guys, if it's clear, just say clear. Okay, so it's 2 days. The first day, technical skills day, and then the second day will be the OSCEs, communication, and the clinical skills. Now, you may ask me, Doctor, what does it mean by technical skills day? How does it look like? So, guys, the technical skills day will be one, right? They're going to be 6 tasks in a day. What are the 6 tasks in a day? Will be 3 tasks in preparation and 3 tasks for restoration. What sort of preparation task are you going to do? Endo access cavity, case preparation, crown preparation. What sort of restoration tasks? will be composed restoration. Again, composed restoration because we removed the amalgam now. There is no any more amalgam restoration. And then provisional crown. Is that, guys, clear so far, guys, how the first day or second day in exam will be? Let me check if the candidates say yes. If one, yes, okay, thank you very much, Dr. Niga. Thank you, Dr. Shama. Thank you very much, Dr. Samir and Dr. Natalia, and everyone. Fantastic. Now, you now need to start the preparation as early as possible, right? So in this case, how you start? What sort of course can help you in this? As Dr. Franzi mentioned, right? We have different type of courses for technical. Again, guys, don't lose the track, okay? Please, guys, don't lose the track. Now we're talking about technical skills day. We're not talking about OSCE, only the light blue. You see, guys, this light blue box, we only talk about it right now. So now I want to really pass the 6 tasks. How can I learn the 6 tasks? We give you options to learn them. The first option is on-site courses. We have 2 locations for you. We have Sydney Academy and Melbourne Academy. Dr. Franzi, she actually found Melbourne Academy closer to her, so she came to Melbourne Academy. There are candidates, they can come to Sydney Academy. I'm by myself, I'm guys existing in both, in Sydney Academy and Melbourne Academy. Duration for the course. The course, it can be either 2 weeks or 3 weeks course. Before, during Dr. Franzi time and Dr. Ann time, we used to do only 2 weeks course. But these days, we decided to give the candidates more time. And that's why we do a little bit more longer period courses, which are for 3 weeks courses. And every week in the course will be 60 days. And then every day will be 8 hours. Guys, is that, guys, clear so far? Is that something hard here? So now, if you want to pass the technical, you have options. The first option is on-site course. Now, what is the advantage of on-site? We can teach you definitely from basics. And then that's going to be suitable even after longer break from the industry. We see candidates, they maybe they don't have that enough clinical experience, and sometimes they're away from the industry. So this course really going to suit you. You will have hands-on training with all demonstration for every task, every single task. We're going to give you demonstrations, and also we're going to give you hands-on training, like you're going to do the work in front of us, and then we're going to fix your tasks. Or if you have any issues, if you have any questions, definitely we'll be help you with this. Definitely, guys, we're going to share, because Dr. Alifia and me, we are the most experienced dentist ever teachers for ADC. No one can claim this. Ask anyone, can you claim that you are the first person has the longest period of experience for ADC than Dr. Alif or Dr. Adam? No one can claim this. And continuously, we never stop teaching candidates day and night. So we're gonna give you our experience, me and Dr. Alifia, to help you with our tricks, right, to pass the exam. We're not going to teach you ordinary stuff. We teach you the most important things to do to pass the exam. I call them, candidate know about this, okay? Candidate, they come to me mainly because they want to know the shortcuts, like this, and that's it, and then you pass. And then definitely, guys, assessment. You must have very good eyes for assessment based on experience. We're going definitely to do criteria discussion, which is very important. Mock exams, you're gonna, guys, get mock exams. And then all detailed feedback. The good thing about technical is, I'm thinking right now, every one of you guys knows what's Be Delicious, right? This is the first time, your batch, March batch, was the first batch ever. I gave them Be Delicious. And when I saw that Be Delicious has helped you to pass part 1, I'm thinking right now, or take it seriously, to start Be Delicious for part 2. I was talking about this with Dr. Ann, and she said that's going to be good help for every one of them. And then that will be very structured and will be easy to do the task in the right ways. Even Be Delicious, I will give you even my experience with small tips and tricks how to pass every task with, I would say, least effort. Teacher style will be step-by-step guidance. We're gonna be close to you. We guys hold your hands. There's my technique. Since the long time ago, I used to get next to the candidates and then hold the hands and then teach them everything from the beginning, because we understand some of you away from the industry long time ago, so they really need more attention than anyone else. Anyone else. So my belief always, I never gave up on any candidates, but I want the candidates as well not giving up. You see my video today with Dr. Shiley. Dr. Shiley, she came in the academy and then she, before her exam, and then guys, you can see the tray in her hand. She got lots of teeth and lots of jaws, and then she said next to me and said, okay, doctor, what should I do now? I said, okay, come sit down here. We can fix everything. But say I'm going to pass, because you're going to pass this time. She said, okay, I'm going to pass this time. And she passed. How do I know? As Dr. Alefia said, we can tell which one can pass and which one need more work. And then when we tell you do this, listen. When we ask you to do this, listen to us, because we know exactly what's going on. Tell you something. In part one, do you know what? The candidate they failed in my mock exam, the candidates they failed treatment planning and evaluation cluster. The same cluster they failed in ADC exam. Today, I got messages from many people. Doctor, I'm very upset on what should I do? I now got crazy with my clinical treatment evaluation. Even your mock today, even I failed. The last mocks, even I failed. In ADC exam, I failed. What does it mean? Means my mock exam, it's a good reflection of ADC exam. The people they couldn't pass professionalism. They fail in my mock professionalism. How do you know this stuff? How we can reach this level? The way that we understand the system in and out. Experience. And definitely, we put ourselves for you guys. We help you. We put ourselves for you. Now, Dr. Franzi, what do you think about this option, the technical? Do you want to add something here in this part, Dr. Franzi? The on-site technical. Please, guys, also, guys, if you have questions, you can start ask about only the technical part, if you want. This is Dr. Franzi.
To me, it was very helpful. I've worked as a dentist for 10 years before coming to Australia, and it's just very different though, because it's got nothing to do necessarily just with whether you are able to do a filling. Of course you are trained, but it's about the structure that the exam is scored upon, that you need to be aware of at every step of the way of what you're doing in these jaws that you're getting for the ADC exam. And I think the on-site technical was just eye-opening, so you're not starting blind, that you're not wasting teeth, that you know what to look out for and what is expected of you. I think that was very clear. And for me, that was the way that I wanted to do it as well, because I didn't want to doodle around at home and then think I'm doing it right. And then a few months later, when I'm doing the on-site, I have to change course completely because I was not aware of how it was scored, of what the ADC was looking for. So I found it very helpful.
Okay, that's a great guide then. So, Doctor, thank you very much, Dr. Franzi. Dr. Alefia, would you like to add up something here to help the candidates?
Yes, Dr. Adams. So like Dr. Franzi said as well, that it's really, really important that when you start off coming for a technical on-site course, obviously if you can, is the best decision ever, right? Because exactly like Dr. Franzi said, you don't want to start off at home, do a few preps, and then be so confused and learn some wrong techniques, and then eventually have to change your techniques and all of that things, because ADC equipments, materials are expensive. You don't want to just do it on your own and then struggle eventually, right? So having an on-site course is really helpful. And like you said, Dr. Adam, or like when you were talking, I was thinking like how the students love you when you're teaching them in part one, while you're not even physically present with them. You're just online. But imagine your students having to have you physically present with them. Like you said, you actually hold their hands and you teach them. I'm sure it's going to be really beneficial for the students, which we've seen in the last how many years we've been teaching, right? So yes, having an on-site course is really helpful if you can make it physically to the academy. Like I would say that's the best decision ever.
Thank you very
Doctor.
much. Thank you. Okay, now, there's a question here. Which teeth? We're going to discuss, Dr. Ray, about all this next time, but I will answer your question definitely here. Which teeth to buy, doctor? The new platinum teeth, yes. If you really can buy new platinum, yes. But in the same time, I believe the new platinum will be really expensive. So in this case, if you can get somehow the plain one or a little bit cheaper one, that will be much better still. Because I believe the consistencies are still closer to each other. A little bit changes, but yes. Okay. Okay, guys. So this is the first course for technical. We still, guys, please, guys, don't lose a track. We are still on the technical skills day. We give you the first option, which is on-site courses. Okay, the second is the online. Give me just here. It's option B, online. So online courses, guys, session times, exactly like part one. You remember part one? We ask you to be available from 7 to 10 because sometimes we can change time based on how close is your exam. And then most of the session at 8. Normally we start at 8. Session length, like part one, about 2 hours. Course duration for online is 8 to 12 weeks. It will be on Zoom. We're going to give you demo, right? So we're going to give you demos. I believe like this. I'm going to show you some of the demos. Maybe I will be able to do it right now. Give me 1 second, please, guys. I'm trying to make things clear as much as I can. Okay. Okay, guys, for example, let me share this. That's, guys, just only, I'm going to show you something which I really, normally, I don't share my stuff with the public like this, because I told you my stuff is very, really important. Okay. So let's share. And then I believe we can share from here, this one. Guys, something like this. Okay. We do composer illustration, show you the technique, right? How to do the composer illustration. And then that's online. And then we go on the steps, give you everything in details and explain the criteria and everything to make it easy to you. By the way, guys, that's enough. I don't want to show more than this for my work because always a secretary for me. What's the tricks? Okay. Let me go back again. Is that, guys, clear to everyone right now? Okay, so the second option, online. For who exactly, guys? This is mainly for the candidates. They cannot attend the on-site. For example, you are overseas, and then you cannot come to the academy on time, and then you need to take visa. So in this case, my recommendation is to join online OSCE. Forget about online OSCE now. Online technical. Then later on, when you have visa, so you can get the on-site course. If you can do this, you can get 1 week on-site course for the exam, 2 weeks on-site course, 3 weeks, depends on your financial and depends on your availability. But you should start first with online. Then after this, you can move to on-site if you have time. Is that, guys, clear to every candidate they are from overseas? So now if you are overseas, my suggestion is to start with online technical, online OSCE, side to side, while you are actually collecting your home setup. Okay? In online will be You can, by the way, guys, we'll give you some advantage by you can rejoin the online again without fees, but this is depends on the condition availability. What does it mean? It means, for example, if we have too many candidates and then joining, for example, online, so in this case, we may ask you to pay the extension fees as we do for part one. Sometimes we believe, for example, that your exam is still, for example, let's say, if your exam in March, sorry, September, and then we're gonna do 2 courses from now until September. We let you to join for free until your exam in September. So try, guys, to be very understanding because you definitely understand about your finance, and we try to help you in this part. So, guys, to clarify this part again, we may let you to join the online for free in this condition. If your exam maybe next year, in let's say March, and then we're gonna run courses from now until March. At this time will be, guys, you will be eligible to join the course again until March. But, or actually, guys, keep it like this. Okay. Guys, that guy's clear for online. Because Dr. Ann, she has done the online, and Dr. Franzi. So, Dr. Ann, what do you think about this option? Because you did both. You did
I
online and then you did
Yeah,
on-site.
I was about to tell you the same thing because I did the both things. So I can tell you that for the people who are overseas, online technical helps because you're not going someplace else. You're just listening to Dr. Adam, you're listening and watching his skills. You're learning all the tricks online. You're practicing at your home setup, and once you feel ready, you can come on site and do the task in front of them. So I remember very clearly, I went to Melbourne Academy myself, and both Dr. Leaf and Dr. Adam were there to help me out. And trust me, guys, the quality of help we get on site is so better than online. But we understand that there are circumstances like me. I couldn't get my visa on time, so I couldn't be on site. That's why I joined online and made my notes. I learned all the steps. I practiced everything by myself at home first, so that whenever I was to visit Dr. Adam on site, I was ready and he could work on my shortcomings. So this was very great opportunity for me. And like Dr. Adam said, he do extends a lot of courses and helps us out. So I think it's a very great opportunity for the people who are overseas, who are like me. So I think this helps. Yes, Dr. Adam.
That's a great then. Okay, thank you very much, Dr. Franzi, because you did online as well. Did on-site and online both.
Yes. Obviously, for some people who don't have a choice, like Dr. Ann said, like this is still great. I agree though, like when you are there in person, it's different because you can like turn it, you have it in your own hands. When you are looking at my work, you were putting it under the microscope, you were really like looking at it under the magnifying glass, and things sometimes are not visible, like when you're taking pictures, all these things, even when you're trying to take good pictures of your work. And of course, online technical helps a lot. But like really getting that extra mile, and when it comes to fixing something that keeps reappearing in your work, for example, like you've got a chip somewhere on the margin every time and you don't know how to fix it. When somebody sees you put the matrix down and can watch you while you're doing it, they can help you better. So online technical is great though, because obviously you have the support and you can ask all these questions as well, and you will get help and people will figure out what's going on as well.
Yeah, I totally agree in that. Thank you very much, Dr. Franzi. And now let's, guys, say you did on-site course or maybe online course, and then you want to come down to the academy because, guys, we will never leave you behind. We're always next to you. We always trying even to push you, try to motivate you to do things. And then you want to, for example, come and see me or Dr. Alefia or Dr. Franzi or Dr. Ann or anyone, for example. In this case, You want to present your work, as Dr. Franz said right now. You present the work to me, for example. In this case, you can book some, we call it as under supervision. Like you book some classes the whole day under supervision. You even can come for assessment, 1 hour assessment, 2 hour assessments. And we're thinking right now, me and Dr. Alethea, we thought about this idea. That's we're gonna give you guys some credits to use it, especially with packages, because Dr. Franz, do you remember which package did you get for the course?
I had everything.
Which one?
I had the one that has everything. I forgot the name. It's been a
The one
long
has
time.
everything.
Yeah,
Dr. Lama, can you remind us, please, Dr. Lama, because like you, I don't know this stuff. The
I think
academy,
golden package, was it Dr. Fancy? I don't remember the name either. Was golden package or something?
isn't there like one that's above that as well? Like I had
Like
everything included in my
yeah, I don't
package.
remember. I can't
Yeah.
remember the name as well. The diamond
Dr. Alethea?
one?
Guys, I'm teaching, so no, most probably I don't know really the names of these packages and stuff. I leave it for the admin of the management.
Hello, doctor. This is Dr. Lama.
Hi, Dr. Lama, how are you going?
Yeah, she's referring to the diamond package, the highest package we have
Diamonds.
that
That's
includes
the
all
one.
four groups. Yeah.
Thank you, Dr. Lama. Okay, guys. So most probably, Dr. Franzi and that's guys what we found. Most of the candidates they stick to the diamonds package. I think they are the most candidate they pass. But again, I want the candidate to talk. I want them to come back. I want them to share their own work, and then they ask questions during my sessions. And then when I do online, Dr. Email mentioned this. Dr. Email said, I am the one who's mostly ask questions in every sessions. And Dr. N was telling me the same things. Right, Dr. N?
Of course, I remember Dr. Miles. She used to be there. And in fact, with Dr. Franzi as well, I remember Dr. Franzi, she had the best communication skills ever. And I remember her from 113 batch as well. Is that right, Dr. Franzi? You were from 113, right?
That's 113, yes.
Yeah, I
I was
remember
thinking
you.
about that before. Yeah, yeah.
And she
Very
was the
good
most
memory.
active person there. I remember she used to help candidates out all the time. She would ask questions as well. I remember her.
Yes.
Yeah, we
Okay,
all
that
had
was good then.
nicknames back then.
Okay. Okay, guys, that's good then. And definitely, guys, we are very, very lucky to have the best champions ever in this process, in this family. In our OSCE, we have the best dentist, and was technical as well, and part one. Now, work on the supervision. You can guys book 1 day, 2 days, 3 days, 4 days, 5 days. It's up to you. That's gonna be extra help. What we do is we supervise you. We give you personalized feedback. We focus on the weak areas. For example, say, I do composite, but I found that my composite cusp height not good enough. So we teach you how to fix the cusp height, for example. And then we guys assess your work and we tell you this work now it can be passed or it can be failed. Why it can be failed and how to fix it to make it pass. Then the most important thing ever. Everyone talks about this one. Everyone talks about the support. We are the best people to provide support. We're running behind the candidates. The candidates, right? I keep telling them, please ask. Guys, please ask. Right? We run behind them. Come back. I sometimes call the candidate. I call them by myself. As much as I can, because I'm human, by the way. Especially the candidate, they are in contact with me. For example, if you said hi to me one time, you're gonna be in my head, and I keep thinking about you, who you are. But the more you communicate with me, the more I know who you are. Even if you go away for some times, I'm the one gonna get back to you. So guys, what we do is in Telegram group, we give you 24/7. You know this very well from part one. We do similar things in part two. I showed you guys this, my champions who passed the exam. I showed you this. How guys it is. I even can look at it right now, showed you back again. So you can drop your work at any time throughout the day, take a photo,
send it on Telegram group. We assess your work. And by the way, Dr. Email has mentioned this as well to you. She said, I am the one who used to post too much. When I ask my friends to do it, they used to say, I'm lazy, I cannot do it. And she said, because she used to this, she passed. And her friends that didn't do this, they couldn't pass. And totally agree on this. By the way, Dr. Email, she passed her technical exam every time. She said the exam, she used always to pass technical. Was no issue. Get responses at any time of the day. You will find Dr. Adam, which is me, Dr. Alethea, and Dr. Ann, and then our more tutors, guys. Guys, exactly so far for technical. Do you have any question about technical? Because after this, we're going to move to OSCE. Any question, please, guys? Okay, please. What is a reasonable cost range for home setup to prepare effectively? What do you think, Dr. Franzi and Dr. Ann?
It's been a while, Dr. Peter. I honestly don't remember because I did not buy everything in one go as well, which is probably not the best idea as well. Like there are package deals when you're buying it new. So you can compare the prices of a new setup to used ones and make your decision based on your space and your needs and your budget as well. There are definitely different options for everybody out there, and it will still do the job just fine.
Okay, very good then. Dr. Ann, what do you think?
I agree with Dr. Franzi here because I didn't buy the complete setup together as well. Silly me. I had to buy in bits and pieces. Actually, when I cleared my exam, a lot of things were out of stock. So I had to wait and then buy. So it was just not a great idea for me as well. So yeah, you can compare. You can actually see if somebody is giving you a complete setup for a very good price and they are in an excellent condition. Of course, you can buy that. Just be aware of the scammers. That's all.
Okay, very good then. Dr. Alethea, what do you think?
Hi, Dr. Adam. Good question. Home setup, like we've been doing this for the last so many years, so we know what's there in the market, which all companies have come up, and you know how sometimes some of it's sad to say that some of the ADC students, once they pass, they sell the wrong stuff to other people because the ones who come new, they don't really understand. And I see that a lot, like when people come in the academy and they're like, oh, I got this from somebody else. And I'm like, this is not even ADC stuff. But people who pass, they already know, and somehow sometimes they just want to sell their stuff. So you got to be a bit careful with whom you're buying your stuff from as well. So do your research, look up the ADC practical examination handbook. That has a lot of all the information you need for your home setup, which is basically the same materials you'll be using in the exam. We will be doing a home setup session anyways to help you all on Sunday, like Dr. Adam said. So I will go through all the stuff which you all need for the home setup and maybe give you all some recommendations of what we've seen in the past, of what items are good and what are not from different companies maybe, and also guide you on how you can buy from other candidates as well. So maybe hold on till Sunday, and then you all will have most of your questions answered. So make sure you'll join that session as well on Sunday.
Very good. Okay, there is two questions here, very important questions. That's from Dr. Niga. How we can spot scammers? You don't need to spot scammers, but I may give you some suggestion. Just tell me the name of the candidate. I can tell you should you buy from this candidate or not, okay? Because I know all the candidates. Where can we contact? But by the way, our candidates are nice candidates, okay? But no, most of the candidates, they're good. But just tell me the name. I can tell you who this person, and they even can help you with this. Where can we contact other doctors to buy stuff from? We have our own Facebook, but I'm not active there, guys. I'm just keep it for the public, for everyone. Even I don't manage it. I don't know what's happening there exactly. I don't have time for it because I focus on you, not this group. It's called buy, swap, and sell. EDC, buy, swap, and sell. I may even share it with you. How does it look like? It has about 8,000 candidate there, about 8,000. It's the biggest one. You can go there, and then even we have the ADC part 1. Guys, there's very important group, which is ADC part 2 group as well. You can ask there, or you can ask on buy, swap, and sell. Guys, is that guys clear so far, guys? Any question about the technical part? If you are overseas, if you're in Australia, what things you need to do to know about it and to pass the tasks? Okay. Okay, thank you, Dr. Ann. Dr. Ann, guys, share the link to you here in the Telegram group, and sorry, in Zoom chat. Okay, OSCEs. So now, guys, we finished with the first day, which is the technical skills day. Now let's move to OSCEs. OSCEs has 2 parts in it, right? OSCE, as you see right now, it will have communication skills OSCE, and the B will be clinical skills OSCE. So guys, the OSCE day has 2 things, not only one thing. Okay, let's now talk about the first things, the communication skills OSCE. You're gonna get 60 cases. Call them 60 cases, call them 6 rooms, whatever you want. OSCE altogether, there are 10 rooms. 6 rooms are communication, and 4 rooms in the exam, right, will be clinical skills OSCE. Let me show you one video, small video right now, guys, to give you a little bit of, like, to imagine what's going on. Actually, I will read this. After I read them, I go through them, I will show you now a video. From this video, you will understand it better. Actually, you know what? Videos first. Because once you get the video, I think you will be able to... Give me 1 second, please. Okay, let me share. Guys, can you see my screen? Guys, can you see my screen? Yes, no, because I don't know if you can see or not. Okay, can you guys hear the music as well?
Welcome to the Australian Dental Council examination.
Let's see, guys, yes or no? Yes, can you hear the music? Okay, very good.
Centre in Victoria.
Guys, you can see this in the ADC website.
Is the venue for the 2-day general dentistry practical examination. When you arrive for your examination, take a seat in the candidate waiting area, ready for registration. One of our examination team will call you to the candidate's registration area to take your photograph and verify your identification. Please present your government-issued identification, which must be valid and include your photograph and signature. This could be your driver's license or passport. Remember to register with the same identification on both examination days. Once we confirm your identity, we'll give you an identification badge, which you must wear at all times. Your identification badge includes your schedule for the day. The ADC will provide you with all the materials and equipment you need to complete the examination, including burrs, gloves, masks, and gowns. Place all your other belongings into a locker where they will be securely stored for the day. You cannot return to the locker room at any time during your examination. The only items you can bring into the examination centre are your lunch and your safety eyewear.
Okay, guys, I would say, okay, guys, this part you can watch on your own, but let's just jump into the important things I want to show you. So now we're talking about OSCE. Before even we talk about the technical day. Technical day, guys, is a setup for technical day. This is how it's gonna look like, the technical day, guys. Okay?
Need any additional?
And this is one dental mannequin, guys. And we are in the academy. We have the one dental mannequin as well. Okay, now, OSCEs. How OSCE gonna look like? OSCE room, the communication OSCE will look like this. We just get the OSCE, communication OSCE. Let's start from here.
Clinical examination, or OSCE format. You will rotate through 10 stations on your clinical
So there are 10 stations, 10 rooms or 10 stations, 10 tasks.
skills day. Start of the day, we will show you an orientation video in the candidate briefing room, and you will be able to ask questions. Your convener will escort you from the candidate.
Here, guys, where your heart will stop. In this area, your heart will stop. Am I right, Dr. Anna, Dr. Franzi?
Yeah, for the first time, definitely.
You will be like speechless. Like, I cannot talk anymore. I'm mute now. Yes, from this point, this corridor.
Lounge to the candidate OSCE corridor with 10 numbered doors. Check your
10 numbers means 10 rooms. This side seems like has more rooms, like 6 rooms in this side and 4 rooms in this side.
schedule. Stand outside your first room.
If you look here, you will find there is rooms. Look, like there is rooms. Like I think this room, that was room 3. So it seems like 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, like this way, because it's room 3.
Your first room and wait for further instruction. Rooms 1 to 6 are set up as standard.
So 1 to 6 are communication skills.
Consultation rooms. Rooms 7 to 10 are
Okay, this is, guys, OSCE, the clinical OSCEs. We're going to discuss about later on.
set up as dental treatment rooms.
So this is, guys, dental treatment skills OSCE. That's one, we call it clinical skilled OSCE. I'll explain about it later on.
Each room will have a different task. You may be asked to have a conversation with a live simulated patient or perform.
This is the communication OSCE room. There are 2 examiners, not 1. The first examiner will act as a patient, and the second examiner will assist you on this tablets. They listen to you, they'll watch you closely to understand who you are exactly, and then scores what you say. Guys, is that guys clear so far? Guys, I guys clear so far, guys? I'm trying to make things easier for you. Okay, thank you.
Procedure on a model or mannequin. There will be an examiner in each room who will.
And there's a clinical OSCE, only 1 examiner will be, not 2 examiner, only will be 1. And then you see, you here, there's going to be a mannequin, not a patient. You don't have a real patient in the whole exam. No real patients, only mannequin.
Mark your performance using a tablet. The screen in each room displays your task for that room. The screen includes a timer and buzzer to help you manage your time. You will have 3 minutes reading time, 10 minutes examination.
Okay, guys, so 3 minutes reading time and 10 minutes examination time.
Time and 2 minutes changeover time.
And then 2 minutes change over. Altogether 15 minutes for every case.
Your convener, examiner, or dental assistant will be on hand to answer your questions.
Okay, guys, is that guys clear so far? Let's now go back to the PDF file. You will get more information there. We just stop this one and then share
You can take
the screen again. Guys, I'm thinking to get my dinner. What do you think, guys? What should I get then? No one has good suggestion? I know you can say kebab, right? Without saying.
Thai.
So,
Thai is good for your keto.
yeah, for keto, yes, that's why I only eat meat. Like I don't eat any carbs, so anything but no carbs at all. Okay, now back again, guys, to this. Already panicked. Yes, yes. No, no, Dr. Nagai. You wouldn't be panic move. But that's okay. It's normal. Dr. Franz can tell you about this. Now, communication skills OSCE. 6 rooms, as you have seen. 2 information gathering. 2 rooms, diagnosis and management. 2 rooms, clinical treatment and evaluation. What they assess you exactly in communication skills when there are 2 examiners. One acts like a patient, and the other one with a tablet, and they assess you. What they exactly assessing you? They assess your strong communication skills, your clinical knowledge, your clear clinical judgment, your critical thinking. They assess these things. If you know how to do these 4 things in the right way, you will pass communication skills. Exam format, structure, separate rooms. I showed you this one. 1 room at a time. You have seen this. Reading time, 3 minutes. You have seen this. Role play, 10 minutes. We said this. Examination time, 10 minutes. Total per station, 30 minutes. And there is another extra 2 minutes. So altogether 15. And then examiner will be 2 examiners. One going to act as a patient, and then 1 examiner assessing via tablets. You have seen this by yourself right now. Now you may think, what is the recommended course for communication OSCE? The recommended course is online communication. Do we do on-site? Yes, we used to do inside, and we do inside, especially role plays, but the most structure is online. Why? It's somehow similar to part 1 exactly. Online communication OSCE, exactly like part 1. What will you learn in this? You're gonna learn how to communicate effectively. Use the correct language and terms. Critical thinking, we're gonna teach you in every class the critical thinking. Just what you need to do is listen to me, write down what I'm saying, practice on it the right way, that's it. And clinical judgment, course structure. Guys, imagine 7 classes per week, approximately. Almost 7 classes per week. I do 2 classes, Sundays and Tuesdays. Dr. N does, by the way, guys, that's the first time ever we have Dr. N to help us in part 2. Dr. N used before to help us in part 1. Now it's a big changes to be in part 2. And she's helping now in part 2 as well. Dr. N will have classes, and then we have Dr. Nikki as well take communication classes as well. We do case discussions. We go through the role plays. You have about, let's say, 60, 70 cases in total. With their topics, we discuss them. It's easy things, not hard at all. You know it, will be perfect, and that's it. And that's it. Okay. No worries, Dr. N. Okay. Now, we give you live question answers in every session. All your questions will be answered. And then if you still have more questions for any reason, you leave it for me on Telegram, and me, Dr. N, Dr. Nikki, we all actually help you in this. Study materials, same exactly like part 1. We give you Google Drive, and I have the capsules. The capsules, guys, I may show it to you next time, not this time. Capsules has everything in it. It's my notes. It's something similar to diamonds, but not as delicious, because delicious is something different, completely different. The one I'm planning to do it. In this case, if you really guys get delicious, will be like, I don't think you're gonna struggle with OSCE anymore. But the capsules, it's more like diamonds. It has a case, it has a map, discuss all the case with references. It has good explanation, justification, and references. The black box, it has all the secrets in it. It's my recordings, simplified explanation. I explain to you how to go through every single scenario. It's about 20 to 30 minutes per each recording. Guys, we are the first people ever in this world has started teaching OSCE. At that time, no one knew exactly what's OSCE. Everyone even teaching right now at that time, and most probably they been as a student. Maybe I'm like out of my memory, maybe I'm wrong. But however, except maybe one or two tutors, maybe at currently right now. But at that time, we are the first people ever started with OSCE. And we have the highest pass rate in OSCE. And our candidates hardly any one of them struggle with OSCE. Why? Because if just for what we're saying, they don't stuck. Okay, Dr. Franzi, what do you think about this part? Communication OSCE.
Yeah, definitely a very big one to start with. Yeah, and definitely like your structure has definitely worked for me in both attempts. Like I did not struggle with communication OSCE in either of my attempts. And yeah, I followed the approach that we were doing in the course, and that has served me very well, especially with managing my stress in my second attempt.
Look, you should have passed with first attempt. We know why. You went somehow out of the road, out of the way, only because of stress. That's it. No more than this. And we
Yeah,
discussed
with
this
my
when you,
amalgam task.
huh?
With my amalgam task on my practical day. Yeah.
Yes, but mainly because of stress. If
Yes.
you could have just control stress in the first attempt, you know what has happened, right? You should have just passed, and that's it for first attempt. But it's okay. It sometimes happens. I tell the candidate sometimes happen, right?
Yeah,
Okay.
definitely.
Thank you very much, doctor. Okay, that's fine. The third thing is clinical skills OSCE. As you see, was only one examiner, not two examiners. Dr. Alifia, can you please explain about this part, Dr. Alifia?
Yes, Dr. Adam. Clinical skill OSCE. So, like Dr. Adam was explaining
Can you
that,
please, Dr. Alifia, come a little bit closer to the mic because I think your voice is a bit far. I don't know why.
is that better?
Same mostly.
Is that better?
Yeah, now it's better.
Okay, perfect. So, like Dr. Adam was explaining that in our OSCE day, we have two things, right? One is the communication part, and then we have the other part, which is the clinical skill OSCE, right? So that would be on your it's same part of the OSCE, but it's another different from communication, right? So in your skilled OSCEs, basically that consists of 4 rooms out of the 10 rooms, because in those 10 rooms, 6 of the rooms were your communication, and then your other 4 rooms are your skilled OSCE ones, which I'm talking about, right? And in skilled OSCE, you have around 10 different kind of stations which would actually come in your exam, but out of those 10, only 4 of them will be there in your exam. So either or, right? They can select any of those. So I'll give you examples. Like one of them could be like a rubber dam task. Like you get 10 minutes and you need to place like a rubber dam on the mannequin, right? Or it could be like a local anesthetic, something like that. So there are different kinds, and all of that is a part of your clinical treatment and evaluation cluster. So that's what your 4 rooms would be.
Yeah, same structure somehow, but only one examiner, and you're gonna practice on mannequin the way you have seen it. And then there's cameras in the room, both in communications OSCE or clinical OSCE, the same. And then, as you see right now, yes, Mr. Trelef, you can please continue this part.
Yeah, so what we normally recommend as a course for this is firstly, even like what Dr. Franzi said, that don't ignore the other aspects of the exam. Like sometimes you get focused on something like probably communication, and then you eventually would ignore something like skilled OSCE, but that also is 4 rooms of your exam, right? So it's a big part. So you can't ignore this part and be like, okay, I'm just going to do this like, a week before the exam or 2 weeks before the exam. So basically what we have as a clinical OSCE course, it is like a part of our on-site technical course.
But obviously, if you can't make it during the on-site technical, you can just come only for a skilled OSCE course, which would be like a 2-day course where we cover all of the things which are required, basically all those 10 stations which could come in your exam, right? So in that we have an entire setup exactly like ADC for the skilled OSCEs. We have the exact same X-ray mannequin or the radiology mannequin. We have the exact same local anesthetic mannequin, which you have in the exam. And these things are expensive, so you can't really buy them for your home setup. So you definitely need to come to the academy to do this. Firstly, to learn, and then you have to even come back again to practice, because something like a radiology mannequin, you wouldn't buy it for your home setup. It's really expensive, and you won't ever use it again, right? So these things you definitely need to come to the academy for that. So that would be like a 2-day course, and we normally club it with our on-site technical. But if you can't be there for on-site technical, or if you're a part of our online technical course, then you have this option to do only the skilled OSCE course separately, which is a 2-day thing in the academy.
Yep, totally agree on this one. And guys, if you read this part here right now, we guys going to demonstrate all the tasks to you. Gonna be hands-on training, and then step by step, guys, guidance with immediate correction if you do something wrong. We sometimes, guys, we ask you first, if possible, we can capture a video of you while you are doing the things, and then after this, we actually show you in the video what went wrong and how you can fix this. Definitely, guys, for both, we're gonna have a separate for communication OSCE. You're gonna have a separate 24-hour Telegram group, and for skilled OSCE, clinical OSCE, you wanna get separate as well, 24/7. Sorry, guys, 24/7 Telegram support as well. Dr. Franzi, what do you think about? Okay, do you want my advice, guys, for skilled OSCE? People, they underestimate it. They think they only can come 1 day or 2 days, as we do 2 days, just before the exam. And then they can practice only 2 days, and then they can pass the exam. No. Skilled OSCE, you just do the course at least 1 month or 2 months before the exam. And we're now thinking to do it online as well somehow. So you can help you even if you are overseas. So you get enough information. We give you notes, we give you files, like PDF files, has all the cases you need to go through, which is going to help you. But you still need to take the course a little bit, not too close to the exam, a little bit with enough time before the exam, so you can practice nicely at your home. Don't depend only on 2 days course just before the exam. You need to take them maybe a month for the exam, and then you practice at your own. What do you think, Dr. Franz, in this part?
I actually did it twice. When I had my on-site practical, I had like a appointment collision anyway, so I couldn't do my skilled OSCE right after my technical part. I'm not sure what the structure is now, but it used to be 2 weeks, and then the last day of that 2-week course, it was skilled OSCE. And I had to reschedule with that. So I was basically doing skilled OSCE a little bit later, which came in handy for me anyway. And then I came back another time to the academy as well and did skilled OSCE again. Because exactly like Dr. Olivia said, like certain things you can simulate it at home, especially when you've done it more than once. You can simulate the scenario for X-ray, for example, but you still need to know exactly how the mannequin works first, because otherwise you won't feel comfortable on the exam day. Yeah, that you're not making a mistake that you're not even aware of. And yeah, I did come back. Was I audible? I don't think I can hear Dr. Peter anymore.
I think he's
Am I
lost
audible?
connection.
Am I audible?
Yes, better now, Dr. Adam.
Okay, sorry guys, because I don't know why I couldn't hear me. Okay, so guys, we're going to take your questions right now. If you have any questions, we are very happy to take this. That's number one. Number two, on Sunday at 8 p.m. Sydney time, guys, we have a session mainly for home setup. So again, give you explanation about home setup. Again, as I said, it's too hard actually to make only one session to cover everything. So in this case, we divided things to make it easy for you. So guys, do you have any question, guys? I'm here, Dr. Olivia here, and Dr. Franzi. Let's guys check the questions, please. Also, if you can check the Facebook, Dr. Olivia.
Yes, Dr. Adam.
Yes, please. If you can, please check the questions on Facebook or in here, and please start to answer them, please. The time changing from 1 to this time I changed 2 minutes. Yes, 2 minutes, yes, not 3 minutes, 2 minutes, yes. Dr. Tibali ask question. Can you please answer this, Dr. Olivia?
I'm
On
just
Zoom.
looking at the question.
Okay,
On
no
Zoom,
problem. Take your
okay.
time. There's one question on Zoom. I think this question is well there.
Okay, so Dr. Dipali says that can we do skilled OSCE twice on site, once with the 2 weeks technical, and then again when we come for the 3rd week of technical? Dr. Dipali, as a part of your course, obviously you will have skilled OSCE only once. You are more than welcome to do skilled OSCE twice, but that will obviously be a separate charge. However, during the technical course as well, sometimes when you're a bit overwhelmed with what's going on with technical, or you'll want a bit of a break, what we normally do is we tell the tutors or we tell the students that if you all are getting a bit tired with technical, or if you're getting a bit bored, we give you all like a bit of time just so that you'll can go through the skilled OSCE. So you'll do get time to practice during that time, but obviously it might not be like a full day of supervision. So but your course would be only once, your skilled OSCE course. So I hope that answers your question, Dr. Dipali, but you would still definitely get time to practice skilled OSCE. Dr. Homar says, how long to prepare for part 2 and how many hours per day should be allocated personally? For part 2, I would definitely say 2 to 3 months preparation is really required. If you have more, that's obviously an added benefit. But like we tell all the students, do not wait after your part 1 to start with your part 2 journey, because everything what you all have learned in part 1 is really helpful in your part 2, especially for your OSCEs. So you don't want to start forgetting things what you've learned in part 1. Like even now, since it's been almost a month, more than a month for your part 1 exam, I'm sure that you'll have forgotten a few things from part 1. It's not as much as fresh as it was when you all were giving your exam, right? So the more the days pass, that's how you'll keep forgetting things. And we all forget things, right? We all, as dentists as well, even now, we go back to TG, like sometimes in the clinic, we forget some kind of a dosage or some medication, those one-off scenarios which we don't see every day. We always have to get back to books. So since you all are so thorough, like right now you'll have so much knowledge in your mind, in your brain, because you'll have just done part 1. So I wouldn't want you all to waste any time. You want to start part 2 ASAP. But definitely giving yourself 2 to 3 months of preparation minimum would be good. Not saying that people have not done it in a month. We have students who've come to the academy just before the exam. They've done like 3 weeks of the course only, sat for the exam, and they've cleared the exam as well, right? So obviously you want to try yourself to give yourself more time. Try to give yourself more time. But if you don't have time, or for some reason, you end up booking your exam, or you do end up getting a seat earlier than what you thought, it is still doable. So that would be my advice. Material is provided. We do provide materials like all the consumables, which you all will use during the course. However, there are certain other materials which you'll have to buy yourself, because that'll be your individual practice, how much material you're going to use, and your equipments as well. And you will use those same things when you'll go back home as well. So we always have y'all to buy the materials and equipments yourself, because you all need it for your home setup too, right? So you're going to get those same stuff in the academy, but we do provide you all with certain consumables and your day-to-day stuff which you all will be using. Dr. Maria says that yes, overseas dentists have a lot of visa issues. Totally agree. We have seen this. We faced this a lot of times, We've seen such amazing students who do not end up getting a visa for the exam, or we've seen some students who've booked everything for the course, and then on the day of the course, we're like, oh, damn, they couldn't make it because of some visa issues or all the things which are going on in the world right now, right? So y'all, that's why we have made arrangements for online technical course, and our online technical course is as effective as our on-site technical courses because we have the same tutors who are conducting them, right? Dr. Adam is also conducting on online technical. Myself, I'm also conducting online technical. So we all are the same tutors who are doing the on-site are there online as well. The same demonstrations, everything. So you start off with that, and as soon as you can manage to get your visas, and obviously you have to come to Australia to give your exam, so you will have to apply your visa, right? So maybe just closer to your exam, if you would want to come to the academy, do a week course or do a 2-week course, or even if you don't want to do the full course but you want to just do work under supervision, that would also really help. And we've seen that many of our overseas dentists, we have so many overseas dentists coming in who've passed, even recently, so many people who have passed. Dr. Beto, do you remember last batch, the doctor who came from Iraq? I don't know if Dr. Adam is here. Yeah, he passed this time. You all must have seen his photo as well. So it was the same with him too, like coming just before, doing online technicals, coming just before the exam, and staying in the academy for 3 weeks straight, and then sitting for the exam, and then you get through. Dr. Maria says, so coming for online technicals beforehand gets a little difficult. Yes, I totally agree. Price for the 3 weeks course, you will get all the information. See, because we are tutors, we don't deal with all of this, like the pricing. Our main goal is to help you all. The pricing, the name of the courses, we honestly don't even know the name of the courses, that all the admin manages, because we have a full team of administration staff who deals with all of this. They come up with the course prices, they come up with the offers. That's all their department. So you can ask the academy, get in touch with them, and they'll give you all the details on the pricing. Honestly, I don't know the pricing myself either. Okay. Any other questions on Facebook? Let's check. On Facebook, I can see fried chicken for Dr. Adam's dinner. That's what somebody's
They
commenting.
actually give me, actually order something, they give me juices. They order juices now, which I don't drink.
Who has ordered the juices? You?
Yes, I order food. They actually deliver juices. They give me big bottles of juices, and no dinner for me. Then seems like.
Erosion and caries, Dr. Sanchari says. So Dr. Sanchari is a very good dentist.
I will not drink them. I don't like juices.
And
I
she
mean,
looks
like,
after your health, Dr. Adam.
I don't. I just keep them. I don't know, but the guy had switched the orders. Maybe that's okay.
Call them, they'll bring it back for you.
They very weird. They don't know that I didn't eat since morning. I'm just waiting for this food now, and there's no more shops now. I believe. Like,
Dr. Priya
any more
says
questions,
that,
Dr. Alefia?
yeah, Dr. Priya says that she has contacted the admin team few times for pricing, but she's not got a response. Dr. Lama, are you here? Dr. Lama from our admin team, are you here? Or Dr. Leah, are you all
Yes,
here?
yes, doctor, I'm here.
Yeah,
Yeah, I am here.
can we please help Dr. Priya, because she is asking for the prices, but she says that she's not got, like, she's a bit confused still. So if you can help her, Dr. Priya Nirang is her name.
I will reshare the page link because like I am already on the page right now. There are no pending requests or anything.
Yeah,
So
if
I
you
will
can.
reshare the page because I think maybe she is contacting another link for us or one of our professional accounts, not the
Sure. If
professional.
you can get in touch
Yeah,
with her,
so
that'll be nice. You know her name, so if you
yeah,
can message
sure.
her and
Yes,
just give her.
definitely. I will reshare our page again for anyone. This is how they can contact me. I'm also available on Telegram. So whichever it's suitable for you, Dr. Priya, I'm here for you.
Yeah, our admin team is really amazing, by the way, everyone. Dr. Lama, Dr. Leah, they're always there. Like you'll have seen them being there 24/7. Like anytime you message them, they'll be available. So don't
They
hesitate to
really
reach out. Yeah, I agreed, right, Dr. Franzi? Like
Yeah,
you've
very
been in
true.
contact
Every
with
time
them.
that if there is just any hiccup, even with your link expiring or anything, for a session, like it's always very, very,
Yeah.
very quick. So
Yeah,
thank you for that.
like our admin team is the main people doing all of this in the background, like because we are the tutors, we are in front of y'all, so you'll always see only us doing things, but honestly we are just doing maybe the tip of the iceberg. They are doing a lot of stuff in the background to help you all pass the exam, right? So they are always there available, so reach out to them. And most of our admin team are dentists themselves, so they understand your struggle, what y'all are going through as well. Okay, so definitely reach out to them and they'll get in touch with you.
I am so sorry. I will have to run because I have to travel today for another 5 hours and I can't
Oh, that's
miss
all good,
that.
Dr.
I'm
Franzi.
so sorry. I'm very thankful for having me today. If anybody has any more questions to me personally, like everybody can feel free to reach out on Telegram to me. I will make sure that I get around to everything. Sorry that I have to cut it short on my end now. I will just miss my flight otherwise, so I will have to run.
No, Dr. Franzi, you've been really, really helpful and patient with us, especially being overseas and all the internet issues. So thank you so much for being there
Thank
for
you very
all
much,
this.
Dr. Franzi.
Thank you so much, guys. And I'll still be around and I'll come to the academy. And yeah, all the best of luck to every candidate. Congratulations to everybody who passed the exam. And I'm sure you guys will do your very best and you'll be successful. And all the very best for everybody. Thank you so much.
Thank you.
Thank you
Bye-bye.
very much. That was very
Bye.
helpful. Thank you very much. Okay, guys, for tomorrow will be a mock discussion. And on Sunday will be the home setup, complete home setup, only for home setup only. Thank you very much. Thank you, Dr. Alefia. Thank you, Dr. Ann. Thank you, every one of you guys. That was our pleasure, guys, helping you.
Thank
Hopefully,
you.
I get my dinner then. Yes, please tell me.
Thank you, everyone. We'll see you all on Sunday and tomorrow as well. Yes, Saturday and then Sunday.
Thank you very much, you guys. Have a great night, every one of you. Thank you very much, you guys. Bye bye. See you guys. I'm very excited for the session. I'm very excited for part 2 sessions, the new ones. Thank you very much, you guys. Thank you. Thank you, Dr. Sharma. Thank you, Dr. Sanchari. Thank you, Dr. Dipali. Thank you, Dr. Zumuza. Thank you, Dr. Mashal. Thank you, Dr. Ravori, and everyone, guys. Thank you very much. Have a great night. Thank you, Dr. Alefia. Okay. Thank you, Dr. Hipaki, Dr. Natalie, Dr. Homa. Thank you guys very much, you guys. Have a great night. Thank you. Okay, and if I'm going now, thank you, Dr. Alefia. Bye-bye.